3 in 1,000 babies are born with some type of hearing loss each year in the United States. Hey guys, welcome back to the Momma Nurse channel, where we discuss everything nursing, motherhood, and lifestyle. Please subscribe to our channel. I'm Vanessa. Make sure you hit that notification bell so you can be notified every time I drop a new video. So sorry for my temporary background here. My son is napping and he just hasn't been feeling well, hence my voice as well. I'm starting to lose it. I just wanted him to have some rest, so that's why I'm in a different setup. So it will be temporary for this video, and then we'll get back to our normal background. So every time that you deliver a baby, every time you have a baby, the state requires a in-hospital hearing test to be done prior to discharge. I can't speak on every state. I've had all of my babies here in Florida, so I can only speak for Florida that it is a requirement by the state, and only assume that it's required in all states across the U.S. So within the first 24 to 48 hours, it's required for your baby to have a hearing test completed. We never had any concerns or issues with these hearing tests until we had baby number 4. With the 3 previous deliveries, the baby went for their hearing test, came back, they had their certificate, and everything was normal. We never had any worries or anything like that. So when we had baby number 4, they attempted to do the hearing test, came back and let us know that they got referred as the test results. So you can either get pass or refer. And pass, you obviously pass. Refer just means that further testing needs to be done. Basically, it was inconclusive. The requirement by state is that a patient or a baby could have 2 hearing tests in the hospital setting. If both of those hearing tests come back as refer, then they have to do outpatient testing. So they did the first test, we got the refer, so then waited a couple hours and they tested him again and they got referred for a second time. So by law, they couldn't test him again. We just had to follow up on an outpatient basis to have the hearing test completed again. His first appointment with his pediatrician once discharged from the hospital, I let them know that he got referred for the hearing tests and that we were directed to come to them for further options. So they referred us to a facility that's in our area that does newborn or infant hearing testing. During my maternity leave, I went ahead and called this facility, and unfortunately, due to the pandemic, our audiologist was no longer in office. The person was at high risk for contracting the virus, so they decided to take an early retirement. So because of that, there was no audiologist in office that could perform the test. So this kind of put us in a bind. I spent a good deal of my maternity leave calling facilities that would take our insurance and calling facilities that would test somebody as young as my son. I never realized age that he is. Most hearing facilities only start testing children at the age of 7. So anybody younger than that was going to this one particular facility. But like I said, they did not have an audiologist. Towards the end of my maternity leave, and mind you, during all of this, I'm getting calls from the state because it's required for them to have this on file for each baby that's born. So every week or so, the state is calling me to see, if we found a facility that could do the testing, when he was going to be tested, and things like that. So it was a very stressful time during my maternity leave because I'm supposed to be enjoying my baby, enjoying my family, and I'm literally every day making phone calls, leaving messages, and trying to get all of this situated. Finally found a facility after a whole bunch of digging, a whole bunch of phone calls, made an appointment, and I think about a week before the appointment, they called me back and found out that they did not accept our insurance. Canceled that appointment and we were back on the hunt. Long story short, I finally was able to find a facility that would take our insurance, and we set up an appointment. But unfortunately, they were making appointments like a month out, so we still had about another month to wait. So the thing with infant testing, they only test you up to 5 months of age. Once you hit that 5-month mark, I honestly don't know what happens at that point, but they will not test you. The reason being is because for the test, they need the baby to sleep at a maximum of 2 hours. So the older a baby gets, the less that they'll sleep for those longer durations. So it's easier to test them as soon as they come out of the womb or within that first week or so, because more than likely they're going to be sleeping and they'll stay asleep for a longer period of time. So when my son did get tested, he was about 4 months and a week old. So we were right on that cusp. I was so nervous the whole time because he wasn't sleeping as much as he used to. You know, at the 4 to 5 month age range, they're awake, they're more aware of their surroundings, they want to see what's going on, and they're fascinated with everything. So I was so nervous that he wasn't going to sleep through the test. I wasn't sure what our options would then be. During this waiting period, I did make a point to talk to him extra, I feel like, and engage him in different sounds. Deep down in my heart, I did not feel like he had any hearing deficits, but ultimately we did not know for sure. So because of that, I wanted to make sure that he was hearing sounds. If there was any type of deficit, I wanted to do my part to hopefully help him out in that department. Some causes of infant hearing loss: brain injuries, low birth weight, maternal drug or alcohol use during pregnancy, lots of fluid or vernix, fast deliveries, infections or premature births, jaundice, maternal diabetes, hypertension, also known as preeclampsia. So there are 3 methods to test hearing in infants, and once you have to go for the outpatient hearing test, they do complete all 3. And 2 of those tests are the autoacoustic emissions test. This is where they put a small probe into the baby's ear canal, and they send a sound to the probe, and then the baby's ear should send an echo back. And the other test is the auditory brainstem response. So for this test, they had 3 electrodes on him. One was on the top of his forehead and then one behind each ear. So during the testing, they put those on in the beginning, and then of course it was connected to long wires. And then when they got to the autoacoustic emissions test, then they just put one probe in each ear at a time. Whichever ear they were testing, that's the ear that they had the probe in. So they scheduled the exam for a 2-hour time block. Basically, for that 2-hour time period, they want your baby to be sleeping. So what they recommend is that you don't feed baby when they wake up that morning, if you have a morning appointment, and try to keep the baby awake for as long as possible. The facility that we had to go to for this testing, it was an hour and a half away from our house. So there was no way that he was going to stay up for that drive. Also, being that the pandemic is going on, they only allow one parent. They don't allow anybody besides that one parent and child into the office. No way that my spouse and I could go, because that 1-hour drive plus a 2-hour wait and the 1.5 hour drive back. So it makes sense. So what we did was I worked a half shift the night before. So I worked from like 1 a.m. to 7 a.m. That way I was away from him. And so typically he won't wake up during the night if I'm not home, being that he's not smelling that breast milk around him. I had him work that half shift. I got home that morning. I had already told my spouse, make sure you don't feed him. Even if he wakes up, just try to rock him back to sleep. So he was fine. I got off that morning, got home, took a shower. I already had our bags and everything packed and ready to go. Got him dressed, and then we were out the door. It was a horrible morning weather-wise. It was raining. It was foggy. I had to pull over for like a good 10 minutes because I literally couldn't see the road. I couldn't even see the car in front of me, how bad it was raining. Thankfully, we made it there safely. We went inside, had to sign in and everything like that, and actually they were running a little bit behind schedule. So this kind of made it even harder for us because I knew the time was ticking for him to be ready to eat. And as we were waiting, you know, he's giving me that look like, okay, I know it's time for me to eat. But thankfully, he was being good. They came out and let us know that they would be calling us back soon. They apologized for the delay. At that point, she said that I could go ahead and feed him. So what I had done was I brought like a half a bottle of breast milk. So I gave him that, and I knew he wasn't satisfied because he started fussing. But I didn't want to give him too much because I knew if he nursed from me, there would be a better outcome. So we got to the back and they went ahead and set everything up. They put the probes on him, or the electrodes on him, and he was wide awake. Like, he was literally looking at the audiologist like, okay, what are you guys doing? He was bright-eyed that morning. So we tried to dim the lights and see if that would, you know, make him start to get sleepy, but he wasn't having it. So she said, okay, go ahead and nurse him and we'll see what happens. So they stepped out. I nursed him. He was still wide awake. What I decided to do, I stood up with him. He was already set up and ready for the exam. I stood up with him, and within 5 minutes, if not less, he fell asleep. So I sat down, I literally held him like this and did not move for an hour straight. All I did was just look straight ahead. I kept my eyes open. That way, if they were directing me to turn him or anything like that, I could do that. But I knew in my heart that if I moved an inch, he was going to wake up and it would be a done deal. If he's sleeping on me, he'll sleep for a good amount of time, but I do have to stay still. Because that movement, being that he's not in his normal sleeping position, that movement just wakes him up automatically. So I knew I had to stay still. So the exam lasted about an hour and a half long, and he slept for majority of the exam. When he did wake up, it was during an exam that he could be awake for. But they did say that if he were to wake up prior to the exam being finished, that have to have one, a longer exam, or two, results weren't in his favor, he would have to come back and do it again. So thankfully he made it through the hard part and he did pass. I was so happy. They said that even at the quietest levels that they sent to his ears and his brain, whatever it is, he was able to respond to it. So I was so thankful. It was definitely a stressful 4-month period just waiting to have this done. You always want the best outcome, but ultimately you never know. Anytime there's a question about something, you know, it can go either way. Whether he had passed or failed, we would still love our son no matter what. But I am thankful that he does have his hearing intact. And I'm thankful that God was on his side and helped us get through this little struggle period and the stressful period for me trying to find a facility that would test him and everything like that. I thank the audiologist that did a great job with caring for him during that testing. All right, guys, that's it for this video. I hope you enjoyed it. Don't forget to subscribe to the channel. Leave any comments down below and a like on this video. And until next time, stay safe, be well, and live life.